Hello friends, today we are going to discuss about nursing care plan for gastritis. Nursing assessment. Subjective data. Patient complaint of epigastric pain and burning. Discomfort in the upper abdomen. Pain level. Objective data. Abdominal tenderness and restlessness. Nursing diagnosis. Acute pain related to inflammation of the gastric mucus, as evidenced by epigastric pain, burning, and discomfort. Call to relieve pain. Planning. Assess the pain level using pain scale. Keep in comfortable position and use relaxation techniques. Administer analgesics and antacid according to the medical order. Give small frequency meals to reduce irritation. Provide health education about avoiding spicy and acidic foods. Apply cold and heat therapy. Implementation. Assess the pain level using pain scale. Kept in comfortable position and used relaxation techniques. Administered analgesics and antacid according to the medical order. Given a small frequency meal to reduce irritation. Provided health education about avoiding spicy and acidic foods. Applied cold and heat therapy. Evaluation. Patient verbalized relief of pain more than earlier. Next one. Imbalance nutrition less than body requirements related to nausea and vomiting. This video is in our YouTube channel.